Welcome to this explainer. Today, we're diving straight into a fascinating clinical study guide to untangle one of the most insidious medical mysteries known to science. We are going to piece together exactly how this incredibly stealthy disease operates, from a completely silent, invisible exposure all the way to a devastating final diagnosis. But first, I want you to think about a rather shocking question to kick things off. What microscopic fiber takes 40 entire years to strike? It's a concept that highlights a truly terrifying latency period. Just imagine inhaling something totally invisible today, going about your normal life for decades, only to face the devastating consequences a whole lifetime later. Well, the answer to that mystery is malignant mesothelioma. This is basically a highly aggressive, malignant neoplasm, a rapidly growing tumor that springs from the mesothelial cells. Those are the protective cells that line the pleural cavities around your lungs, as well as your abdominal cavity or even your heart. It's an absolutely relentless disease, and it's strongly linked to heavy industrial and occupational exposure. So, here is our roadmap for today's explainer. 1. The asbestos time bomb. 2. Decoding the PAMB spectrum. 3. The diagnostic challenge. And finally, 4, prognosis and key takeaways. All right, let's jump right into part 1, the asbestos time bomb, and look at the anatomy of this insidious threat. It really all starts with amphibolous asbestos fibers. Specifically, we're talking about types like crocidolite and amesite. When someone is subjected to heavy exposure to these microscopic needle-like structures, it eventually triggers a devastating clinical presentation. We're talking about progressive dyspnea, which is a relentlessly worsening shortness of breath, right alongside intractable chest wall pain. Add to that severe constitutional B symptoms like unexplained weight loss, relentless fatigue, and fevers. You even see physical signs like digital clubbing, where the fingertips actually swell up and round out. And this timeline reveals the shocking latency rule of asbestos exposure. If year 0 represents that initial exposure, it takes a good 10 to 20 years before we might even see the formation of benign plaques or fibrosis. But the ultimate consequence, mesothelioma itself, waits for 30 to 40 years to finally reveal itself. Think about that. People who worked in shipyards or construction way back in the 1980s might only just be presenting with symptoms today. Moving right along to section 2, let's decode the PAMB spectrum and identify the usual suspects. Medical students actually use a fantastic high-yield mnemonic, PAM, P-A-M-B, to rapidly recall the entire spectrum of these conditions. It's a great mental checklist. P stands for plaques, A stands for asbestosis, M is for mesothelioma, and B stands for bronchogenic carcinoma. By keeping this simple acronym in mind, clinicians can quickly categorize the exact potential threats facing their patient. Now, it is absolutely vital to separate the harmless bystanders from the active, aggressive threats. Pleural plaques, for instance, are completely benign. They're just asymptomatic markers of past exposure, well-demarcated calcifications that have zero malignant potential. They are not going to turn into cancer. Malignant mesothelioma, on the other hand, is a highly malignant nodular pleural thickening. It forms this large peripheral mass that literally encases the lung, causing ipsilateral lung volume loss. That basically means a severe loss of lung volume on that exact same side of the body. Looking at another suspect, asbestosis. This condition presents with a really highly specific sensory clue. Unlike idiopathic pulmonary fibrosis, asbestosis predominantly manifests down in the lower lobes. When a doctor listens with a stethoscope, they hear B-basal fine, dry, and inspiratory crackles. And you know what it sounds like? Exactly like Velcro being pulled apart. It's a very striking, unmistakable auditory hallmark of asbestos inhalation. But then we get to the B in our spectrum, bronchogenic carcinoma, and honestly, the data here is just staggering. If you combine asbestos exposure with cigarette smoking, the risks don't just quietly add up. They act synergistically. They multiply the risk of getting lung cancer by up to 50 times. 50! It's a deadly combination that turns two independent risk factors into an absolute physiological disaster. Okay, section 3, the diagnostic challenge. Let's talk about how we actually catch this killer. Tracking down mesothelioma requires a rigorous, step-by-step investigation, escalating from initial imaging right down to a definitive tissue sample. Step 1 is usually a chest X-ray, where we're looking for an unexplained unilateral pleural effusion or irregular thickening. Step 2 steps things up with a contrast-enhanced CT of the chest to really closely evaluate that nodularity and fissural thickening. But imaging alone is never enough for a final verdict. That leads us directly to step 3, a definitive tissue diagnosis. Now, you might be wondering, hey, if there's fluid around the lung, why not just test that? Well, because pleural fluid cytology is incredibly unreliable for this specific disease. It has a notoriously low sensitivity. We're talking only about 25%. That means if you rely on testing the fluid alone, you are going to get a false negative, an entirely missed diagnosis roughly 75% of the time. You simply cannot trust the fluid to give you the real answer. Because those fluid tests fail us so often, physicians have to rely on direct tissue biopsies to secure the final, undeniable verdict. Definitive diagnosis requires histological confirmation, an actual physical tissue sample. The go-to procedure here is a local anesthetic thoracoscopy, or alternatively, a CT-guided core biopsy. We need that physical tissue from the pleural mass under a microscope to be able to say with 100% certainty, yes, this is malignant mesothelioma. Which brings us to our final part, section 4, prognosis and key takeaways. It's a pretty grim verdict. The medical literature gives us a really heavy, tragic reality check here. It states that the typical median survival time for patients diagnosed with malignant mesothelioma following presentation is approximately 12 months. Just 12 months. Despite the 30 to 40 years it takes to slowly develop and hide inside the body, once clinical presentation finally happens, the survival time is remarkably, tragically brief. This underscores exactly why recognizing that PAM-B spectrum we talked about and executing a rapid diagnostic workup is absolutely crucial. So, I want to leave you with a final thought to take away from our explainer today. With a 40-year latency period, how many cases of occupational asbestos exposure are still waiting to be discovered? How many silent cases are out there right now in our aging industrial workforce carrying these microscopic fibers, just waiting for their 40-year clock to run out? It's a profound question and a stark reminder that the shadows of our industrial past are still very much with us today. Thank you so much for joining me to explore this complex medical reality.